I'm Dr. Mark Greenstein. We're going to talk about kidney stones. A kidney stone is basically a clump of minerals, salts, or proteins that form together inside the kidney and just sit there getting ready to pass. There are numerous reasons for a patient to get kidney stones. The most common is dehydration. In other words, you are not drinking enough water. The second is diet. Something is getting into your diet, whether it's too much calcium, too much salt, too much protein, that is then causing these crystals to form within the kidney. Other causes are familial. In other words, there's hereditary components. Other issues could be related to protein breakdown within the body, such as when people have gout attacks. There are numerous treatment options for kidney stones. This includes going after them with a ureteroscope. In other words, a camera is placed inside the bladder. That gets then put inside the ureter, which is the tube that connects the kidney to the bladder, and we either pull the stones out or laser them into smaller pieces. Another option is something called shockwave lithotripsy. That's when sound waves are specifically sent through the back to the kidney stone to break it apart. Percutaneous surgery means that we actually go right through your back with a camera through a hole about the size of a quarter, and we actually pull the stone out at that point or grind it up with a device. But the best option for kidney stones is usually prevention. And fortunately, there are some kidney stones that could be solved with medications. Ureteroscopy is the most common form of treating kidney stones in our practice. It involves a surgery where patients will need anesthesia. We pass a camera into the bladder, and then we have a smaller camera that's called a ureteroscope that is placed into the ureter, which is the tube that connects the kidney to the bladder, inside so that we can find your stone, look at it, and either pull it out or break it with a laser. Shockwave lithotripsy is also a very common treatment for kidney stones. This is a non-invasive procedure where patients are given anesthesia. A device is placed under their back, and the device, using X-ray guidance, sends sound waves specifically to a kidney stone seen on the X-ray to try to shatter the stone with vibration and sounds. Those broken up pieces will then pass with time. Percutaneous surgery, which we call PCNL, is when we involve a radiologist. The radiologist will put a catheter through the patient's back directly into the kidney. And then we take that catheter or tube, we dilate it to about the size of a quarter, and we look inside the kidney and we break the stone, pull the stone out, and drain the kidney at the same time. This surgery, PCNL, is used for large stones, usually greater than 1.5 centimeters. A ureteral stent is essentially a polyurethane tube that goes between the bladder and the kidney. We place it by using a cystoscope, which is used to look inside the bladder, and it's this tube that is used to drain the kidney. It does not allow kidney stones to pass. But the problem with stents is that they cause discomfort. We all know it. All urologists deal with it, and it's just an unfortunate thing, but we will give you medications to help with those side effects. Those side effects include urgency to run to the bathroom, pain when you go to the bathroom, pain in your back, and blood in the urine.